Good morning and welcome back to GP Video Podcast by Nadia. Today we will be talking about ADHD and bipolar disorder. I'm sure we all have heard about these psychiatric disorders called attention deficit hyperactivity disorder and bipolar disorder. I would be talking about the physician's guide for distinguishing bipolar and ADHD. So approximately 20% of people with ADHD also suffer from bipolar disorder, which is a serious mental illness characterized by severe depressive and manic episodes. Since both conditions share symptoms, but ADHD is more common, bipolar disorder is often missed or misdiagnosed, it's either missed or misdiagnosed. So ADHD is basically attention deficit hyperactivity disorder, which is usually evident from childhood, and basically it's usually like in the developed countries, it's usually when teachers and parents see the symptoms, they take the kids to the pediatrician for diagnosing ADHD, and usually when it's diagnosed, it's medicated in the childhood. But there is an increasing trend these days that adults are coming more and more for getting diagnosed with ADHD, because what they see is they relate their symptoms to all the Google searches of ADHD calculators and ADHD criteria, and usually they think that their symptoms do match with ADHD symptoms, and because they are struggling in day-to-day world by concentration deficit, attention deficit, so they come to their GPs to be referred to the psychiatrist for being diagnosed with ADHD. But what happens is, because attention deficit hyperactivity disorder, because it is so much known about it, and there is so much material on internet and all about it, so people usually think that they have ADHD. But because ADHD can coexist with disorders like bipolar disorder, and it could be that somebody's suffering only from bipolar disorder and not from ADHD. So this is the domain of psychiatrists to be, distinguishing between both of them. Or they can either coexist, both ADHD and bipolar can be there, or only ADHD, which is usually more common. But then it could also be a possibility that the person is only suffering from bipolar and not ADHD. But of course, it all comes in the domains of psychiatrists. What I'm going to do in my podcasts is I'm going to talk a bit about whatever knowledge I have in the different research papers that I have seen that might help us all. Okay. ADHD's high rates of comorbidity with other neurobiological disorders are well researched and documented. So this is one of the reasons that I would like to talk to you about that. The majority of people with attention deficit hyperactivity disorder also have another condition or learning disability. Yet, accurate diagnosis for co-occurring or stand-alone conditions like OCD, anxiety, and even autism remain discouraging at best. The rates of misdiagnosis and delayed diagnosis are particularly high among patients with bipolar symptoms. They are astronomical for patients with bipolar disorder plus ADHD. So, as ADHD has got high rate of diagnosis these days, after all the knowledge that has come on the net, and people are getting more and more well-researched and well-versed with it. So ADHD is coming more and more into limelight, while the other coexisting disorders, because as the research says that ADHD, in majority of patients, at least if not majority, then at least majority of patients of ADHD have got other neurobiological disorders as well, among which 20% are usually coexistent with bipolar. So conditions like autism, bipolar, OCD, which is obsessive compulsive disorder, they are usually very underdiagnosed. Okay, so bipolar, as I said, the disorder often co-occurs with ADHD, with comorbidity figures as high as 20%. So if among 100% of ADHD patients, 20% also have bipolar, and then rest of them could have other comorbidities as well, such as OCD or autism and others. Recent research also suggests that about 1 in 13 patients with ADHD has comorbid bipolar disorder, and up to 1 in 6 patients with bipolar disorder has comorbid with ADHD. So 1 in 13 patients with ADHD has got bipolar disorder, and up to 1 in 6 patients with BD, bipolar disorder, has comorbid ADHD. This comorbidity rate is significant enough to justify dual evaluations for virtually every patient. Yet, bipolar disorder is often missed or misdiagnosed in patients for many reasons. And we'll come back to those reasons in our next podcast.